welcome back to another Quick Cup of Knowledge. Joining me today is Dr. Sherman Canapp, Chief of Staff at Veterinary Orthopedic and Sports Medicine Group. Dr. Canapp is also double boarded in surgery and sports medicine and rehabilitation. Thanks so much for joining us today.
Thank you for having me. It's a pleasure to be here.
Well, it's a pleasure for us to have you, and we're going to dive right in. We have so much to talk about in such little time. You became a boarded surgeon and then started to delve into sports medicine and regenerative medicine. How did you become interested in that?
It's a combination of the clients and the patients. As patients were coming in doing these sports, I'd never heard of fly ball and agility and dock diving. You have to start understanding what these dogs are doing if you're going to actually educate the owner and also help to not only help the animal, fix the animal, but prevent them from having these injuries again. So as you start diving deeper and deeper, you realize there's some similarities between human medicine, human sports medicine, and veterinary sports medicine. So when we opened VOSM in 2005, as sports medicine group, people are like, what's sports medicine for dogs? Is it greyhounds? We're like, no, it's so much more. Now there's an entire college, DACVSMR, for sports medicine. So it's really evolved. But I think it's because it's so huge in human sports medicine. In equine, it's been going on forever, but finally in canine, I think we're catching up.
So exciting. And you're quite the entrepreneur, which I love and so intrigued. Can you tell us a little bit about some of the different ventures that have sprung from this? Because again, as you mentioned, we're just kind of experiencing some of this in the canine world, and there's so much needed information and training. Can you share some of your ventures with us?
Absolutely, thank you. It's about translational medicine. So how can we as veterinarians, we have so many opportunities in veterinary medicine, and if you look at what's happening in human medicine and how we can work together, animals helping humans, humans helping animals. So if you look at different biologics and devices and techniques that are in human sports medicine, why couldn't we bring those to veterinary sports medicine? So I love the idea of fixing things, hence the reason I'm a surgeon. So I started looking at, could we actually take these types of activities and products and bring them to vet med from human? And that's where Orthobiologic Innovations came about. It was my little hobby in the backyard that now is a full company. And it was really looking at things, techniques, technologies that we don't have in veterinary medicine, but should. And do we have the ability? It's all about data, that we can't just take a product or a device and say we assume it's going to help dogs. So it's another great thing of mine. I feel like the police. I look at these technologies and they can't just release it to veterinary medicine. We have to have data. We have to make sure that what we're doing is helping the animal, helping the patient in return.
And for some students that are listening right now, can you share some examples of what you're talking about? Because this is probably very new to the new students that are going to be soon to be graduates.
Absolutely. So regenerative medicine, platelet-rich plasma, PRP, stem cell therapy, or what we call MSCs, just the biologics. So much happening in horses. That's where it began. In humans, now we're starting to see data in dogs. If we look at other things, laser therapy or photobiomodulation, other types of devices, telemedicine, teleconsultations, it's exploding, and something else that we're venturing into as well. So I think there's so much out there. You cast a wide net, 90% is going to fail, but 10% is going to stick, and it's something that is needed. How can we help the animals and in return help the owners?
So for someone who's interested in getting more involved in sports medicine, regenerative medicine, and they have some of these patients at their hospital that are agility champions or dock divers, what kind of guidance do you give for them to get started? Like what's a great way to take that first step?
So many opportunities that they have. There's different things to college. So as they go through vet school and they do their internships, they can specialize in the American College of Veterinary Sports Medicine and Rehab. They could become a veterinarian and become certified in rehab. There's the CCRP programs and CCRT programs, which are phenomenal. We created our own. We have what's called the VOSMA. It's an affiliation. We're in Philadelphia, Nashville, Seattle, Finland, Australia, about to open in South Africa. So it's basically looking at veterinarians that have like minds, great people, have pockets of animals that do all these sports, and there's a great need. So that's how we created the VOSMAs. And our new one, Canapp Sports Medicine, is another educational venture. Is to look at owners that are just trying to understand more about their dog's injury or how to prevent their injuries and what supplements should there be on and where's the data for all these things that they should be doing for their animals, and also to help veterinarians. They may have a case that they're just not sure how to handle. They may have a case that they need help with the procedure. And now through telemedicine, we can actually log in through programs, one's called Reacts, and actually do the procedure with them. It's almost like AI technology. So that's it's unbelievable how far we've come in veterinary medicine.
And how many boarded sports medicine and regenerative medicine diplomates are there?
Our college is still small. We're babies. I'm the past president. Just honored to be that. We're in the hundreds. It's slowly growing and growing and growing. It's word of mouth. A lot of this is people don't quite understand sports medicine. They say, well, I'm interested in this college, but what really is it? Well, it's this whole sector of understanding sports, understanding prevention, nutrition, internal medicine is a component, regenerative medicine, diagnostic musculoskeletal ultrasound. So you take all these incredible ologies and you put them into this perfect little box, and that's that college.
It's so exciting.
Yeah.
Besides being an entrepreneur, you're also giving back, which we love in the profession. Can you tell us more about Project Go?
This is deep to my heart for years and years. Being in the region of Washington, D.C., where we live and where our practice is, we see a lot of working dogs, search and rescue, police dogs. These dogs, you wouldn't believe it takes $40,000 to purchase and train one of these incredible animals that are helping us, serving the public, but when they become injured, there's very limited budgets for helping these animals. And it was amazing to me how many dogs were coming in with very treatable injuries, but there was no funding. And so that was one sector. Second sector, wildlife. You look at the zoos, the aquariums, they have very little funding, and there's so much we as veterinarians can do to help them as well. And then shelters, Pity Rescue and all these other organizations, they adopt these animals, they can't adopt them, or they rescue them, they can't adopt them to a family if they're limping or broken. So someone has to help these. So that was the 3 buckets that we formed, and that's projectgo.org. It's a nonprofit, and it's to help animals in those 3 sectors.
And is there a way for veterinarians listening right now to get involved with Project Go?
Absolutely. Project Go stands for Global Orthopedic, so we are international. We love veterinarians jumping on board and helping. We have sites around the world that can help. We're always looking for donations because we're a funding source. So if you have a search and rescue dog that was injured and you reach out to us, we're going to look for a location that can help you and then do some sort of fundraising to try to come up with the pennies to help your animal.
Can you think of a really touching success story through Project Go? I know you probably have millions of these, but can you think of any to share?
Just briefly, I'd love to. Canine Porter. Canine Porter's from Connecticut and was out searching for a woman in the middle of the night who was threatening to commit suicide. It was very dark, and the officer and the canine were up on a ledge, fell off a 30-foot wall. And so blew out the wrist or significantly injured the wrist. They went into an emergency center. They put him in a cast. Come to find out they didn't have any funding to help the animal. So an incredible human physical therapist that works on animals, Deb Taraka, she's also a CCRP, veterinary rehab therapist, knew about Project Go. So she reached out to us and said, listen, it's an amazing working canine. Was searching for a woman in the middle of the night, injured its wrist. No one can help them. They came down. We used regenerative medicine. So we actually use stem cell therapy, PRP, with devices. We're talking about Go Gadget Wednesday, so we were using devices to help to protect the wrist as it was healing. Went through physical therapy or rehabilitation therapy. Porter healed, 100% recovery, has now found a few missing children and taken out a few bad guys. So that was one of our, and the whole story was on the news. So if you go to projectgo.org, you'll actually see the newscast.
That is incredible.
It's great.
We need more stories like that.
No, it's great to give back. So many people
Yes.
help us in the veterinary industry. It's the least we can do.
Yes, and so again, your plate is full, but you still find time to teach. And I know you'll be out at the Equendo Center doing some labs. And what is expected there? What are you going to be teaching some of these veterinarians?
The Equendo Center is amazing. We lecture, my wife and I lecture around the world and do wet labs around the world. And every time we're asked to come to the Equendo Center, we're excited. It's 5-star. And so we're doing workshops. And our workshops, we're doing 2 this year. Usually we do 1. It's a 3-day workshop. So day 1 is educating veterinarians on sports medicine. What are the injuries? How do you identify them? Musculoskeletal ultrasound. If you think of ultrasound in human sports medicine, very common. Equine, they were born with a probe in their hands. Why aren't we doing this in dogs? So the entire first day is understanding soft tissue injury in the canine, finding it with an ultrasound probe and learning how to treat it. Day 2, regenerative medicine. We're going to walk veterinarians through all the different biologics that are out there, how to utilize them, when to utilize them, and then practice as well, doing the injections. Day 3 is needle scope. You don't have to be a board-certified surgeon to do what we call microarthroscopy or needle scope. You can not only use it to diagnose certain conditions, meniscal injuries, CCL injuries, rotator cuff injuries, you can use these diagnostics to actually treat as well, or these modalities. The great thing is we're launching a new product through Orthobiologic Innovations, came from the human sector. It'll be in our first workshop, and it's a tablet like an iPad that not only allows you to scope, it has an ultrasound probe that attaches as well. So you can scope or do ultrasound through the same tablet. It's just releasing in human medicine, and we'll have it at the workshop.
Wow. I hope I can come. I know, it sounds so exciting. I mean, you're a pioneer here, and I feel very lucky that we had this time with you, and hopefully you can come back and share more of your projects to come. But thank you for all you're doing for the industry. We're looking forward to seeing you at Equendo and all of the new things that are going to come out of your group. Thank you for all you're doing.
Thank you for having me.